Speaker. Good afternoon, colleagues. This is a pro-cancer bill, period. These vaccines against HPV and hepatitis B, by the way, prevent cancer. It was amazing, the scientific discovery that occurred when we found out we had vaccines that prevented cancer. And once those vaccines went into use, we saw HPV-related cancers and hepatitis B-related cancer, which is a bad liver cancer. Those cancers plummeted. HPV is responsible for 6 types of cancer, 90% of cervical cancers, 70% of head and neck cancers, including those of the throat and tonsil. We have the country's highest rate of head and neck cancers, and even a member of our Senate suffering from that right now. 70% of those cancers from HPV. We have, with these vaccines, a way to save people's lives, and in a state with the fastest rising cancer rates, the second highest cancer rate overall, we should be doing more to prevent cancer, not less.
The chair recognizes Representative Van Buren, Representative Shipley.
Thank you, Mr. Chair. Ladies and gentlemen of the Iowa House. Wasn't planning on saying anything. I just had a couple questions on some of the intriguing comments that were made. I guess the first thought I want to share with the body is that my understanding of nothing in this bill is restricting access to these particular medical products. What it's saying is that if a minor wants this, they just need parents' permission, is what the bill is doing. And I would hope that parents in this state would be aligned with positive health outcomes from their children, and that parents could be trusted to determine those whatever protocols that family wants. So I guess I have a lot of questions. I was hoping, would Representative Baeth yield to a couple questions?
Will the representative yield?
I'd love to.
You are in order.
Representative Baeth, you're a doctor, correct?
Yes, sir.
Do you consider yourself an expert on this particular medical product, the HPV Gardasil vaccine?
I am not a virologist nor a vaccine manufacturer, but I do administer the HPV vaccine in my primary care clinic.
At what age would you recommend a child take this vaccine?
Prior to sex.
What age would that be?
That depends on the kid. This is done primarily in the pediatrics clinic. I'm an internal medicine physician. I treat kids adults 18 and over, but there are some who get it even at 18 and 20.
The vaccine, the Gardasil product, is indicated for children as young as 9. Is that correct?
That's correct.
And so you believe in Iowa a physician should be able to give a Gardasil vaccine to a 9-year-old without permission from their parent?
I believe that a child, especially an adolescent, should be able to have a trusted relationship with a physician. And there are times, unfortunately, when there is not a trusting relationship between a child and their parent. And so sometimes there have to be other adults in their lives who look out to protect them.
So if what I'm hearing you saying, if a parent neglects to give their adolescent child an HPV vaccine, they're an irresponsible parent?
I'm not saying that.
But they're clearly not making a responsible decision to vaccinate their child. Therefore, you have to step in and you need the legal authority to administer that vaccine without the parent's permission. Is that correct?
The data show that in states that have policies that allow adolescents to consent to their own vaccine, HPV vaccination rate is 10% higher. That means 10% more people who are protected against cancer-causing viruses.
Representative Baeth, I'm not asking about the data right now. We can get into that. What I'm curious about is how you handle yourself in your practice, that if there's a 9-year-old child with the vaccine is indicated for...
State your point. Will the bill manager or will the folks come down? Representative Shipley, you have 6 minutes left. Would you still like the representative to yield?
Yes, please.
Will you yield? You are in order.
Thank you, Mr. Speaker. Apologies for Dr. Baeth for my misunderstanding. But in the practice of medicine generally, I'm correct in that the status quo right now, Iowa law, if a physician wanted to administer an HPV vaccine without a parent's permission, I mean, that's current law, and that's what this bill is trying to fix, correct?
Currently in Iowa law, adolescents who have concerns regarding sexually transmitted infections can receive treatment for sexually transmitted infections without the consent of parents. Because kids and parents don't like to talk about sex. And so the alternative would be that a kid goes by without getting treated for an STD, an STI, because they don't want to talk to their parent about it. That is why we have that provision in state law to allow adolescents to have a trusted relationship with their pediatrician or their family doctor so they can get the appropriate treatment.
So hypothetically speaking, if a doctor in Iowa were to administer to a minor child an HPV vaccine, they would have to obtain informed consent, correct?
From that adolescent, yes.
How does that process look? I mean, in a typical pediatrician's office, what does that consist of?
Sir, as I said, I do not treat minors, so I cannot tell you what the exact protocol is in those offices. I will tell you what we do with adults is we verbally go through the consent process and also give a typed up form.
Okay. Switching over to and again, I really appreciate your willingness to have this discussion for the benefit of the public. Sure. Speaking on the cancer crisis, this is pertinent to cervical cancer. How does Iowa's cervical cancer rate compare to other states?
I do not know where we are with that right now. Can you tell me?
Well, my layman's understanding is that we were right in the middle. Obviously, cancer is a huge concern to a lot of people. Yeah. And I know we had the Harkin Institute, and they gave a big report. They talked about lung cancer. They talked about skin cancer. They talked about the prostate cancer and the breast cancer.
Correct.
And I don't think, and again, I read the executive summary. I tried to wait through the report. I don't think cervical cancer even got a footnote in that report.
Perhaps that's because our adolescents have been able to consent to their own HPV vaccines thus far. Maybe that's why our cervical cancer rates aren't as high.
Do you have a citation for that, or are you just making that up? It's just maybe. You don't know. You're saying maybe this is the case, correct? But you can't say for certain.
That is a hypothesis, yes.
Okay. I hope we could test that hypothesis because it's incredibly important. I guess I get a little bit concerned when there's a lot of discussion about the cancer crisis. It's a huge concern to everyone in the building, certainly anyone who's a family member, and yet we're conflating this particular public health intervention with the whole entire crisis. I would posit, and again, I'm just guessing as a layman, I'm guessing we could vaccinate every child in this state with a 3-dose series of HPV Gardasil, and I don't think it would make a single lick of difference in the overall cancer crisis of the state.
I'll remind you, sir, that we are number 1 in head and neck cancers, and 70% of head and neck cancers are caused by HPV.
Well, so the overall cervical cancer rate that I found is Iowa's in the middle. Certainly more cases than there should be, but it's not an outlier. And I don't think it's contributing to the crisis necessarily as the other cancers that have been specified. So I guess I take a lot of concern in the way that this is being articulated. It might misunderstand the public. So how many total strains of HPV are there?
There are 2 of the highest risk strains, 16 and 18, and there are many others.
I saw somewhere that there's as many 200 strains of HPV that exist. Is that your understanding?
Right, there are many. Human papillomavirus is a very large category of virus.
And of that large category of virus, how many strains are known to cause cancer?
16 and 18 are the highest risk strains.
But there's a lot more strains than that would contribute to cancer?
I think there are reports of 2 other strain types. You might ask Dr. Srinivas to that if you like. I'm not an infectious disease physician, but when we look for what we call high-risk HPV, that's looking for strains 16 and 18. So
is your position as a legislator that the HPV vaccine covers all the relevant HPV strains that are connected to cancer?
My position as a legislator is that we should not take away the tools that have been developed through science, through decades of medical science that actually save lives.
And that does not include convincing a parent.
This bill is not about convincing a parent, if we're going to stay on topic.
I think that's exactly what the bill is. The bill is you need to acquire a parent's permission to vaccinate a minor child. That's my reading of the bill.
This bill is whether a 17-year-old can make her own decision.
But Gardasil is indicated for children as young as 9.
As well as 17.
Is a 9-year-old identical to a 17-year-old? For the purposes of this bill, is a 9-year-old identical to a 17-year-old?
Yes.
Thank you, Representative Baeth. I think I'm running out of time. I think the point I'm trying to make is that there's a lot of conflicting information that I'm receiving, and I think this is a good bill because it secures parental rights. And I think if you want to vaccinate a child, I think convincing their parents that that's a good course of action is a very reasonable step that we should have in our law. Thank you, Mr. Speaker.
The chair recognizes Representative from Polk, Representative Srinivas.